Radiology in a minute. LIRADS imaging diagnosis of hepatocellular carcinoma in non-cirrhotic patients with chronic hepatitis C. Radiology research summarized. Current guidelines recommend the diagnosis of hepatocellular carcinoma in high-risk patients via multiphasic CT or the MRI without histological confirmation. However, LIRADS-based criteria remain unvalidated in non-cirrhotic hepatitis C populations. The purpose of the study was to evaluate the diagnostic performance of LIRADS-5 observations for HCC in non-cirrhotic chronic hepatitis C patients compared to their cirrhotic counterparts. This is a retrospective study with a test and validation cohort. Patients were at least 20 years old with chronic hepatitis C. Imaging evaluations were conducted by board-certified abdominal radiologists in accordance with the LIRADS version 2018 criteria. Key results. The test cohort comprised 512 lesions from 458 patients. For non-cirrhotic livers, the LIRADS-5 criteria are accurate in diagnosing HCC, achieving an area under curve of 0.9, similar to performance in their cirrhotic counterparts, and remains consistent regardless of various factors including the stage of liver fibrosis and imaging modality. To generalize the results from the test cohort with a higher prevalence of HCC to broader population, a validation cohort of chronic hepatitis C patients was enrolled at 2 secondary hospitals. In this cohort, 425 lesions in 281 patients were included. The prevalence of HCC was 22.6% in non-cirrhotics and 65.6% in cirrhotics. The diagnostic performance of LIRADS-5 for HCC diagnosis is excellent in both non-cirrhotics and cirrhotics in the validation cohort. The authors conclude that the LIRADS-5 criteria demonstrates high accuracy in diagnosing HCC in non-cirrhotic patients with chronic hepatitis C, similar to their performance in cirrhotic patients.